Hello, everyone, and welcome to Objective Health. I'm your host, your faceless host, of course, Tiffany. And joining me in our studio, we have Doug, Elliot, and Erica. And as always, on the wheels of steel in the background, holding it down for all of us is Damien.
What up?
So today we're going to talk about everybody's favorite topic. No one's sick of it at all yet, I'm sure. So we're going to talk about the COVID and how things seem to be kind of loosening up as governments all over the world are kind of loosening up their restrictions that never should have been in the first place, but that's a topic for a whole other discussion. But businesses are reopening, more people are going out, but of course, you have to do it safely with the mask and everything. But it just seems like recently there's a few articles that are popping up here and there, and it's showing that what was said in the beginning, the health authorities are now backtracking on. And I thought that it would be good to start with a YouTube video from CNN. And this can kind of give a reminder of just how retarded, and no offense to anyone who actually is truly intellectually disabled, but just how retarded this whole thing was earlier when this first came out. I think this video was from March. I don't know if we can pull it up. I can't remember the date, but it's of Dr. Gupta.
It was April 2nd.
And yeah, April 2nd. So it wasn't like that long ago, even though time just seems to fly in Corona land. So that was like about 2 months ago. But this is Dr. Gupta, and he's demonstrating the proper way to sanitize your items when you come back from the grocery store. Do we have that ready?
Yeah, hang on. But there
produce from the supermarket. Sanjay?
So it's interesting. You're not. This is not a foodborne illness. I just want to make that clear because a lot of people think if you eat this virus because your food's been contaminated, could you get it? You can't. I mean, this is a respiratory virus. So it's more a question of the packaging. You just have to think about is there any risk of contamination in other ways? But you're not going to get like a GI type thing from eating the virus.
But so Sanjay, if people feel compelled to sanitize their groceries, I know just like we did with the hand wash, and we asked you to film a tutorial. So let's take a look at this.
Okay, people do need to grocery shop, obviously. Try and limit the number of times you go to the grocery store. That'll just allow you to keep better social distance. And keep in mind, this is not a foodborne illness. You're not going to get it from eating the food, and it's very unlikely you're going to get it from packages. But we do know the virus can live on surfaces. For example, steel and plastic for up to 3 days. I've used a little glitter here for my kids to show you what the virus might be like. We know they can live on cardboard, for example, up to 24 hours. So what I've done here is I've created a dirty area and a clean area. This was a suggestion from Dr. Van Wingen up in Michigan. Here's my dirty area. I'm just going to clean all the virus off here. You don't need to do too much. It's a pretty sensitive virus. You don't need to use any kind of specific wipe either. Any household cleaner will do. And then once I'm sure I got this clean, I put this into the clean area. And again, for cardboard, it's typically going to be closer to 24 hours.
Just wiping that virus all over it.
Well, once you're confident about that, I get all the glitter off.
He just transferred it from the Campbell soup can to the box of spaghetti.
Now, one thing I do want to show you, if you are wearing gloves, and you don't need to wear gloves, the biggest key is how you take them off. You want to make sure you don't contaminate yourself. So you grab the inside of the glove here and pull it over itself, and then I grab with my finger over here from the inside and pull that over as well, and I drop that into the dirty area also. Finally, I clean my hands one more time.
But just two things, just to be clear, you don't need to
Look
wear
at
gloves.
his face. He's laughing.
And
He
also,
knows how stupid it
any
is.
wipe will do. I mean, like a Kleenex or dish towel, or needs to have soap on it, or
Yeah, I don't think you need to have a particular type of wipe, but some sort of cleaner, something like that. It's a pretty sensitive virus.
so it doesn't have to be what do you call it, like a Purell kind of thing.
No, it doesn't have to be a Purell. I mean, even a spray type cleaner, something like that you might use on cloth or whatever. It's a virus that responds. Will be affected by that pretty easily. So that's just an example of what you can do. That's what we've started doing in our house, and leave packaging outside if you get takeout food, and still keep social distance. But works pretty well.
Keep social distance.
But still, the majority of transmission is person to person.
Right, and respiratory droplets that are in the air. You can touch surfaces and then touch your eyes, nose, or mouth, which is why I think it's a very low likelihood for it to happen off of groceries and stuff like that. Mm-hmm. But I think being cautious, especially at this time, is a good idea.
Low likelihood, but still wipe your groceries down. It's so stupid. And then he says, remember, this is not a foodborne illness. I'm like, wait a minute. Didn't this spread by people in China eating bat soup?
Oh, yeah.
Come on, keep your story straight. So anyway, this is just an example of how, now they're saying there's no need to actually do that. You don't have to wipe your surfaces down.
Yeah.
So...
Because it doesn't, apparently, the CDC has actually come forward and said it doesn't spread easily from touching surfaces or objects. And the funny thing is that apparently they were actually pretty covert about how they did this. They didn't actually just issue a press statement or something like that. They just changed it on their website. That's all they did. They used to have it under possible ways that you can catch this virus, and now it's under unlikely ways that you can catch it, or something along those lines anyway.
Mm-hmm. Well, they say it still may be possible to spread the virus from contaminated surfaces. So, which are they purposely trying to confuse the issue? I know people are pretty confused in general.
Yeah.
But it seems like, I don't know. I can't even argue with it because it's just so illogical. There's really nowhere to start.
Yeah, it's true. I mean, how it really seems like the from the get-go, especially CNN, okay? Because I mean, they're just total trash, but it seems like the media from the get-go has been really plugging the fear aspect, how they can make people more afraid. It's not enough that you're afraid of everybody around you because they are disease-carrying mutants that are gonna, give you the plague, but you have to be afraid of your groceries too. And you have to be afraid of everything in the outside world, touching anything. Don't touch your face. Don't touch your face. Oh my God. Yeah.
Well, there was a preliminary study from March that said that the novel coronavirus can remain in the air for up to 3 hours and live on surfaces such as plastic and stainless steel for up to 3 days. So who knows how accurate this study was and what all the parameters that they used to actually come up with these numbers.
Yeah.
But the whole thing just doesn't make any sense. And it doesn't seem like people actually realize that, because I've seen people wearing masks in their cars by themselves with gloves on and the windows rolled up. And people have been wearing masks in grocery stores and other places, but you see them touching their faces all the time. They're not maintaining social distancing. So even the people who are kind of going along with this whole story, they don't see the contradiction in their own behavior. If you're really going to believe this thing, it seems like you should be all in and very cognizant of everything that you're doing at all times in order to prevent spreading this infection. But the people who seem to be really into it, I watch them and they're not doing anything special that would prevent anything, even if they did believe it.
Yeah, that's true.
Well, it's interesting, even with that, demonstration that we saw even stores are continuing with this protocol, even though, like Doug said, the CDC came out and said it's not really a contact point anymore. But, you know, things like if you bring your own bags to the grocery store, they make you take them back to your car. They make you load your bags outside of the store, like if you have your own recyclable bags. But then you walk up to the counter and they take your cash, no problem.
Yeah.
You know what I mean?
Yeah.
So, and it starts to feel like a clown show.
Yeah.
Like, can you stand on one foot and tap your head and rub your belly all at the same time?
Yeah.
You know what I mean? And it's interesting where I noticed it almost as like a fascist approach is at health food stores, Whole Foods, Trader Joe's, Sprouts. They seem to have taken these kind of precautions to the umpteenth extent. You know what I mean?
Yeah.
Whereas places like Sam's Club or Walmart, it's not as intense, if that makes sense. I don't know.
Yeah.
I've noticed that too.
Me too.
At Whole Foods, they're making you wear a mask. I attempted to go to a Trader Joe's just the other day, and their line was all the way across the front of the building, all the way down the side of the building, and almost to the back of the building. Of course, I didn't go in because that's just stupid to wait in a line just to go to the grocery store. But another thing that I noticed is that some of these big chain stores, they used to count people, like be standing at the door and have a little line like in front of Home Depot or Costco or someplace like that. But around where I live, they're not doing that anymore. People are just walking in and the stores are crowded.
Yeah.
They're not prohibiting. They have like a sign up on the door saying only this number of people are allowed in, but no one's really enforcing it, at least not around where I live.
Well, Erica, what you were saying about the health food stores, I noticed that as well. I've got a local health food store close to me. And right around the beginning of this whole thing, they wouldn't actually let you go into the store. You had to go in, you could stand in kind of the doorway, and they would squirt stuff on your hands. And then they would ask you what you wanted, and they would go around and get the stuff for you because you couldn't enter the store. But then you had to walk in to pay. And, you know, the whole thing was just so stupid. And it was kind of like, you know, a friend of mine said at the time, it's like, you know, I thought that like these health food store people were really confident in like how good organic food was for you and all these health products and stuff like that. Shouldn't they be the least afraid of this thing? But it seems like it was the exact opposite. Like maybe it's the people who are like super paranoid and go for all the cleanest stuff that are actually falling for it more. I don't know.
Yeah, it's unfortunate that even though the initial evidence, which I believe wasn't peer reviewed and has kind of been disproven now, it's unfortunate that it's only the initial impression that sticks in people's minds. They read a headline, they see something on the news, which is actually false. And then it's almost like any amount of information can come out after that point. And it makes no difference. It makes absolutely no difference whatsoever in that once that initial impression, that belief, that fear is formed in their minds, then that sticks. And you see that with everything. It's a very interesting kind of mechanism that's at play here. And you see it playing out generally with regard to any kind of social, political, economic event or piece of news that someone comes across. When they first read the piece of information, it's like that stays there, and it's very difficult. It's very, very, very difficult. Even when the initial source, the source of the information, comes out and says that they were wrong, it's really hard for people to actually change their belief on it. And you see that actually, it's same in the UK. Generally, if you are to go to a shop, then the employees basically walk around with like a spray can kind of thing, with like antibac, and they're kind of they have to wash down everything that anyone has touched to make sure that there's no contamination. And when you see that actually there's no evidence that there was ever any contamination, or that even if there is, it doesn't mean that it's infectious. It's kind of funny to watch.
Yeah.
Yeah. Well, another thing that they said in the beginning, did they say this about it spreading from animals to people? I mean, of course, it had to have if it came from the meat market in Wuhan, as they're claiming. But they were testing like house cats, and somebody had like some kind of wild cat, like I don't want to say a cheetah, but something. They tested that, and that big cat came up with coronavirus, and they were testing all these animals. And, there was this fear that it could be spread, it can jump from your house cat to you.
Mm-hmm.
But now they're saying, of course, that's not possible. It's not happening.
Yeah. It's the media is being so disingenuous in all of this, because they're the ones who are spreading all this stuff in the first place. And then when they come out and correct it, or they don't necessarily correct it, but they come out with the whatever's next in the news cycle, they don't reference back and say, we told you this before, but it turns out it's not true or something. And they'll just add it in there as if they never said anything differently before. It's kind of
like it's just an afterthought.
Exactly. Yeah. I mean, it does seem like more information is starting to come out in the mainstream press. It's a little closer to the truth, at least. But one thing that happened recently, and this is like huge, the CDC actually confirmed that the coronavirus death rate was actually remarkably low, right? And it got no press. Nobody said anything anywhere. There's an article actually on the Blaze. Actually, Damien, maybe you could pick that one, put that one up. It was called Horowitz, CDC confirms remarkably low coronavirus death rate. Where's the media? And it's a good question, because like they basically came out and said that its overall is, what was it, 0.26% is the overall death rate for COVID. And you combine that in with your chances of actually getting it. That's only like people who actually get it, your chances of dying, 0.26%. But then your chance of actually getting it, put that on top of it, and it turns out that your rate of actually, your chance of dying of COVID, if you're actually like a reasonably healthy individual, is like, you're more likely to get struck by lightning, or have a horrible car accident or something like that. It's ridiculous. But you don't see that level of information getting out there into the mainstream media right now. They're still stoking the fire,
And that was a genuine statistic, right? It was saying that people under a certain age, they are statistically more likely to be struck by lightning. You are statistically more likely to die in a car crash. You are statistically more likely to, experience many other fates rather than COVID-19. Again, this concept of making very kind of extreme predictions, which had very little evidence. I mean, what was the initial prediction of the death rate? I think it was Ferguson in the UK at Imperial College who predicted that there was going to be 50 million deaths worldwide. And it's, as the data is coming out, it seems that, what is it? They think that the amount of people that have had it without actually becoming sick, so they get the virus, but actually, they recovered from it, and that was fine. I think they said that it was up to 50 to 80 fold times the amount of people that they originally thought would be able to get it, but be okay with it, if that makes sense, if I remember correctly. Basically, the predictions were massively overblown, completely criminally overblown. Now, whether this was just sheer incompetence or whether there was some kind of nefarious agenda there, that's something that needs to be taken into consideration. But ultimately, either way, best case scenario, they were just downright wrong. Worst case scenario, they were intentionally manipulating us. But the effects that this has had is that people are still left with the initial kind of impression that they were given, or they still are under the impression that this is an extremely dangerous disease.
Mm-hmm.
But the evidence does not support that in any sense. This is very similar. I mean, there was a like a meta-analysis kind of thing that came out recently, or statistical analysis, and they basically said the death rates are pretty much the same as the flu.
Mm-hmm.
Like, not much different to the flu. So, there's not all that much to be worried about, as we've been saying for how long. I mean, you don't lock down the world for the flu.
Right.
There is something else going on here. Yeah.
I think it's like we said a few weeks ago, or maybe even a few months ago, like Tiff said in the intro, it's hard to tell. Time has really kind of expanded into this unknown reality, but that it is a mind virus. Like, all of these little tidbits of things are just creating this fear and paranoia. And instead of people objectively looking at the information, they're like, well, we're just going to push forward. What's that saying? Like, no good crisis goes utilized, you know what I mean?
Mm-hmm.
And it's now gotten to the point where it's just a complete inundation of your brain and your energetic system, and you're just going to continue to do all these things that have now been said by the CDC don't work.
Mm-hmm.
Well, as you mentioned, nefarious deeds, Elliot, I think we can see much of the nefarious deeds that are already in place, like the lockdown, certain people not being able to go to work because their jobs are non-essential, being told we have to wear a mask, being told we have to stay in our homes, we have to stay 6 feet away from people. Those are the nefarious deeds that are happening right now. So all of these lockdowns and the things I just mentioned were put into place because of these over exaggerated numbers. So I'm ultra suspicious. I always think that if you're basing what you're going to implement in society on these numbers and the numbers are wrong, then I say that I can be forgiven for drawing the conclusion that the numbers were wrong on purpose.
Yeah. That wouldn't surprise me in the least.
Yeah.
I mean, especially with the lockdown in particular, it's so crazy because, they lock everybody in their homes and everything like that because of these models that they're predicting these deaths based on, supposedly that's why they did it. And then, the numbers are not materializing. So now they can just turn around and say, well, it's because of the lockdown. We had this model and we know what would have happened if we hadn't a lockdown. But what's coming out now, there was actually an article in the Daily Mail about a study that was done by JP Morgan, which kind of made me think, what the hell's going on here? Since when does JP Morgan do these kinds of studies? But anyway, it basically showed that the lockdowns essentially failed. They were comparing different lockdowns, the strictness of the lockdown, when people lifted the lockdown, when people instituted the lockdown, like different countries and things like that, and found that there was absolutely no difference between any of those parameters. Or I mean, there was no difference in the severity of the virus and how virulent it was given those different parameters. So what they were basically saying is that it didn't matter what anybody did, the lockdown did not work at all. So yeah, the whole lockdown was a scam in and of itself. I mean, we've been saying this for months now, but it was nice to have a study to back it up.
Yeah, because when you look at Sweden, they don't have any more cases than countries who did do a full lockdown.
Yeah, it's ridiculous. So yeah, I think they just wanted to lock everybody in their houses for some reason.
That's kind of a conclusion that you'd be you'd be forgiven for coming to based on all of the data, because it seemed like there wasn't any evidence for lockdowns in the first place. In fact, there was absolutely zero evidence of lockdowns, like the benefit of lockdowns. There wasn't really much evidence for anything that they recommended. And they came out and you had major, public health agencies, organizations, institutions, big international kind of bodies who were coming out and making quite solid statements, quite conclusive statements about things that they didn't really know that much about. Mm-hmm. And at the same time, now it looks like they're backtracking on that. And I think it's because the data is coming out and it's not looking good for them.
Yeah.
It's really not looking good. And there's a lot of people who aren't happy. And these ain't just, ordinary working class folk, although that is important. But, these are high level academics, other high profile individuals who are coming out and speaking out against this, have the education, have the, the reputation to be able to actually do some, kind of people will listen to these dissenting voices, let's say. Now, it's almost like they're trying to backtrack because maybe they're anticipating that actually if they're on record for making completely false statements, then perhaps people are going to cotton on and are going to pick them up on it. I hope that they are picked up on all of the stuff that they've been saying. I hope that they're kind of hung, drawn, and quartered in many respects. I don't think it's going to happen, but it would be good if it does.
It's like
well, you kind of
Fauci.
answered the question I was going to put out, Elliot. Like, why would they backtrack? Why would they go against what they said at the beginning? Because I think when the pitchforks come out, when the food shortages really start, when the supply chain is entirely broken, I mean, it's not just because of the COVID, but also because of, weather changes and things like of that nature. People are going to want someone to blame.
Well, it's like Fauci coming out now, Mr. like the lockdown king, always talking about locking down, how dangerous it is. Oh, we can't open up too soon, praising the states that locked down first and all that kind of stuff. Now he comes out and says, oh yeah, if we stay closed for too long, it's going to cause irreparable damage. Irreparable damage. Like, what a weasel. You know what I mean? Like, he's just the one who's sitting there like saying the whole time, like promoting the lockdown and like spreading the fear and then he just turns around and says, oh yeah, we can't do this for too long or else we're going to suffer irreparable damage. It's like, thanks Fauci.
Yeah, it's almost like he's just coming out and saying that because he is anticipating, like he knows he is going to be, people are not happy with that guy.
That's true.
People are not happy with that guy, I'm sure of it.
It's true.
Well, he was one of the ones at first who said, well, there's no reason that anybody should be walking around right now with a mask on. And then a couple months later, you see him at a White House press conference wearing a mask. He and Dr. Birx. And he's sitting there rubbing his face and tugging at his mask. Like, this idiot can't even hold it together for a few minutes on camera.
Yeah.
So,
and kind of on an interesting note is the video that came out. I believe it was Dr. Judy Mikovits, right? The pandemic, was that and how, she had worked with him and revealed a lot of very concerning information about his history in virology and all this. And then YouTube is just on steroids trying to pull that video over and over, straight up censorship. Somebody who's actually like giving documented evidence about the history of this guy, what he's involved in, what he's, worked on in the past. And the fact that YouTube is censoring her videos, it's just like a confirmation, like, oh, don't listen to her. She might actually know what she's talking about. We're just going to censor. And that, to me, was a very eye-opening experience. Like, wow, she must be really onto something if they're taking down the videos at the rate that they are, you know?
Mm-hmm.
Well, they say that censorship is modern day book burning. So censor all the YouTube videos that you can. And of course, there would be no need for censorship if the powers that be didn't feel threatened by what people had to say,
Exactly.
or whether they would be revealing like the man behind the curtain. So I'm not happy for free speech when things get censored, but it is a very big clue when YouTube censors a video that is something that you should be looking into a lot more closely.
Mm-hmm.
Yeah.
So do we have anything else to add about the backtracking?
We could go on for multiple shows on this, I think.
Yeah, well, I guess maybe we can talk about this in an upcoming show, but one of the major things that people keep flip-flopping about is the whole mask issue.
Mm-hmm.
But we can talk about that during our next show. But for now, just it helps to pay attention. I know it sucks to watch the news. Sometimes watch the news, the mainstream news, just to see what the current narrative seems to be and what agenda they're pushing, but really it's really a hassle to actually watch the news because it's so mired in fear mongering and lies. It's kind of like a comedy show. If you get yourself in the right frame of mind, you can have a good laugh, but a lot of the times it's very annoying and nerve wracking and you just want to shut it out. But it's important to keep up with things just to see what might be coming down because they always seem to kind of let you know. Like we still have, what is this, Plandemic 2 coming up, according to Bill Gates.
The second
Stay
wave.
tuned.
Yeah.
Yeah, the second wave, whatever that means. I'm sure we can all come up with our own theories of what that might be, but we have to remember that this is still fairly early into the game, and this, in many ways, or in my opinion, is just a kind of a test run to see what they can get away with, see how people react to the things they're saying and what kind of restrictions they're implying or implementing. And maybe for phase 2, I don't know. We'll see.
We'll see.
So anyway, that is our show for today, folks. If you like this video, hit the like button. You can also subscribe, leave a comment, and we will catch you next time for our next show. Have a good day, everyone.
Bye, everybody.
Bye.